Early in the COVID-19 pandemic, more than 80% of the coronavirus patients in Georgia hospitals were Black, and infection rates of the virus continues to be much higher in the minority population.
And now a new national study aims to look at why that has happened and what we can do about it. Caitlin Ross spoke to the principal investigator.
Dr. Michelle Albert says there's always been an inequality in healthcare, but this global pandemic has shined a light on just how bad that gap really is.
As an African-American woman, we are dying.
Dr. Michelle Albert has felt the effects of COVID-19 personally.
My mom had COVID and it was extremely scary.
She says that experience inspired her to really look at how Black women are impacted by the virus.
Who are oftentimes left out of a lot of studies and a lot of work.
Dr. Albert says Black and Latinx families are more likely to live with grandparents and children, and that makes the possibility of going back to school in just a few weeks even more frightening. While children may not get critically ill, COVID-19 could seriously impact family members they pass it on to.
If corporate Atlanta is not opening up, if these municipalities are not opening up, why are we sending our young, vulnerable children to school who can get infected, come back home and infect their parents, their grandparents, their siblings?
Thomas Dortch is the national chairman of 100 Black Men of America and says he's seen racial inequality in healthcare for years. 11 Alive looked at the numbers here in Atlanta. For every 67 white people who get the virus, there are 98 Black people with COVID-19.
It is extremely high, and it's a crisis, actually.
She says she wants this study to really show everyone how seriously they need to take those recommendations from the CDC, but also to be aware of these numbers and how we all need to take them seriously.
Yeah, absolutely. Such important information. Caitlin, when does she expect the results of her study to be published?
She says this study is on the fast track, so they're hoping to have the data between 6 and 8 months from now.